Do you think you know a lot about drug and alcohol abuse? The Duxbury Parent Connection recently held a presentation called 10 Things Parents Don't Know About Drugs and Alcohol, and included a panel revealing personal stories from parents dealing with their children's drug abuse, a Harvard Medical School doctor, treatment center representatives, and the Plymouth County District Attorney's Office. This panel was there to help parents understand today's changing world of drugs and alcohol. PACTV Community News was there to bring you this story.
Hi, my name is Tracy Wojciechowski. I'm the Regional Director of Student Assistance Programs for Caron Treatment Centers. Caron is one of the largest and oldest addiction treatment facilities in the United States, and I work for their Student Assistance Department, providing education, prevention, and early intervention services to schools. Tonight my presentation is going to be on some of the current trends that we're seeing in drug and alcohol abuse with adolescents. We'll talk about a host of different drugs and synthetic marijuana. We'll talk about alcohol, some of the trends around that. We'll talk about some prescription drugs and just some of the things that teens are being exposed to these days.
I'm Julie Nussbaum, and I am the Director of Prevention for SAD National and the Massachusetts State Coordinator. SAD changed its name and expanded its mission in '97. We now are Students Against Destructive Decisions, formerly Students Against Driving Drunk. And I'm here tonight to talk to parents and hopefully empower them. Parents actually have much more influence over their teenagers' drinking and drug abuse behaviors than they think they do, more influence than the media or TV has. Parental disapproval is actually the #1 reason why teens don't drink, and peer influence is the #1 reason why teens do drink. So it's important to know their friends, to know where they're going, to talk early, start early, and talk often, and just know that you have much more influence over your teens than you may think.
My name's Tim Cruz, and for the last 11 years I've been the district attorney here in the county of Plymouth, and it's great to be here tonight to talk a little bit about social host liability and the impact that drunk driving and drinking and driving can cause to family members in our community. It's great to be here to talk about the real issues and have a great turnout here tonight, and I'm hopeful that the parents and any kids that show up tonight understand how serious the problem that this is and how we can deal with it as a community.
Hi, my name is Marissa Silva. I'm the Director of the Neurodevelopmental Laboratory on Addictions and Mental Health at McLean Hospital and in the Department of Psychiatry at Harvard Medical School. I'm a behavioral neuroscientist, and I study the biology of the teenage brain and how it develops, with an idea that we could understand by using brain imaging technology to understand the development of the teen brain. And so we might shed a little insight in terms of the whole what were you thinking and decision making with regard to how teens make decisions or don't make decisions or become better decision makers. Also trying to understand risk taking and how we can help teens to identify risk and make better decisions around drug and alcohol use and other events that come up while teens are trying to navigate the adolescent period. Part of why I've been involved in this research is that we know for a very long time that the adolescent brain is different than the adult brain, and the advances in the imaging technology have really made it possible for us to have a window into the teen brain. And so if we could start to understand how the brain develops and how we can help keep that brain healthy, then that might give us some insight not only to the effects of drugs and alcohol on the brain, but also in terms of how we can help kids understand how drugs and alcohol affect the brain, how they affect brain development, so that in the long run we could do whatever it takes to help keep the brain healthy. So with all the wonderful medical advances that we know, we can keep a knee going, we can keep kidneys going, but one place where we haven't been as successful is in helping to keep the brain young. So if for some reason all those amazing changes that happen during the adolescent period could help project in terms of how wonderful and how healthy the brain is going to be in the 50s, 60s, 70s, 80s, perhaps this is the most vulnerable period when if we could do the best that we can to help protect the brain during this vulnerable period, we can have very long healthy life of the brain.